Hi everybody, Dr. Jima here. Today we're going to talk about a pathology that exists in the roof of the mouth. This is a bony growth that is benign but may appear to be concerning for majority of people. It may cause some discomfort, and there are things you need to pay attention to if you happen to have this growth in your mouth. Let's talk about it. This pathology is called torus palatinus. This is a bony growth in the hard palate of the mouth. The hard palate of the mouth is actually located in the roof of the mouth. The roof of the mouth is the top portion of the mouth, and it has two types of palates. The front portion is the hard palate, and the back portion is the soft palate. This pathology exists in the hard palate of the mouth. Majority of people that may have this bony growth are essentially asymptomatic, meaning they don't have any symptoms. But it can be painful in the event that there is direct trauma. If it is too large, it can also cause speech impediment. In some cases, there may be food product that may get stuck around the growth, and that can also lead to bad breath. And depending on the size, it may affect your ability to chew or to swallow comfortably. These are all normal or expected signs that may exist if you have this pathology. Now, this pathology has a very unique or characteristic appearance. It may appear flat, lobular, nodular. In some cases, it may appear as a spindle-shaped mass covered with normal mucosa. For those who have this pathology, it actually develops during childhood and progressively enlarges as we age. The actual cause of this pathology is not known, but there is some genetic predisposition, meaning that certain people with certain genes may be prone to developing this bony growth. There is some association with teeth grinding, and also in people over the age of 30. There are 3 signs you need to be concerned about if you have this bony growth in your mouth. Now, this is a very slow growing pathology. It takes several years. So if you see any rapid growth within about 3 to 6 months, that is a red flag that you need to notify your primary care provider or talk to your dentist. As stated earlier, this pathology exists in the midline of the hard palate. So in your case, if it is not in the midline, that is of concern because that may be something completely different from what we are talking about today. Number 3, if it has an atypical appearance, meaning that if it does not meet any of the 4 descriptions or appearances I talked about earlier, that may be something of concern that you need to notify your primary care provider or your dentist right away. If you are seeing ulcers, discoloration, chronic swelling, that is also of significant concern that you need to notify your primary care provider or your dentist right away. If you exhibit any of these 3 signs I just talked about, your clinician will order an ultrasound or perform a biopsy for further investigation. In the event of severe chronic pain, interference with denture use, or any interference with use of oral prosthetic devices, these can be surgically removed. There are no other treatment otherwise. Now, I hope you've been informed about this pathology, and if you happen to have this, you need to pay attention to the 3 signs I just talked about and consult your clinician appropriately. Dr. Jima, I'm out.